still have a question?
Yes. If a person's still in an early phase and they're trying to evaluate treatment centers, and we've already rolled out the smaller centers that have the lower volume, and we're dealing with the major centers which you all represent, I mean, how would each of you on the panel recommend someone determine where they should go? Are there any real differences to note between the way that each of you might do CRT or HIPEC that a patient should consider?
Let's start one by one, I guess.
I think you know, a lot of it just goes into, you know, once you've narrowed it down to the major centers, I think a lot of it goes into just choosing the physician you're comfortable with and the team that you feel comfortable with that you'll want to interact with going forward. You know, like there's a lot of hang up on whether it's closed or open or this or that or 90 minutes. Or, you know, a lot of that stuff probably makes no difference at all. And there's, you know, you lose yourself in the minutia when a lot of it has to do is, you know, am I comfortable with this person, or you know, that gets to be a lot of it. And I think focusing on that once you've narrowed it down to a few places probably is what I would suggest.
I actually get a lot of emails about that, people who have gone to all the major centers and they're struggling with that decision, how do I decide? And my best suggestions are, I think either being close to home or in a place where you have family or support. I think that's huge, because this is not something that anybody can do by themselves. They absolutely need support. And then the next thing is what Steve said. It's just, it really comes down to who do you feel most comfortable with? Who do you just get this sense from, you know, the person that you've talked to that makes you feel the most comfortable? I think that is hugely important.
I agree with what has been said. I mean, really, it's at the end, you know, after you narrow to the people who actually should be doing it, it's up, you know, how you feel about the institution and the people who are taking care of you. Because that is going to make a big difference at the end. I tell the patients, you know, if you know, I have a funny accent, so I tell, you know, if you don't like my accent or something, you know, I don't want to take care of you. If you really have any concern about the institution or the physician, it doesn't matter how experienced it is, you probably shouldn't be there.
You have an accent.
How do you pick it up?
One other thing that the patients have asked me a lot is, you know, people who are considering coming to UMass, they say, you know, Dr. Lambert, I trust you, I know you can do this. What's it going to be like for me afterwards in the hospital? And so and I'm sure you guys do too, I have people who have been through the procedure and been through the hospital stay who are willing to talk to somebody who's thinking about it and wondering those questions. And more than happy to have people come up and meet the nurses who on the oncology floor. And I insist that all my patients go to a specific floor where the nurses are very comfortable, know how to, you know what people are going through, you know, if they're in the hospital the second week and they're, you know, just dragging through recovering and that sort of thing. And all of that I think is important.
This is a team. This is not just a surgeon. It's really the whole institution who is committed to do that. And you know, now all of us are seeing enough patients that when you are there to interview to be examined, usually there are only 2 or 3 patients at the same time that have been operated a year ago, 6 months ago, 5 years ago, that would love to talk to you. And I think that's actually very important. If you talk to patients who have been in the institution that you want, hey, how was it? I mean, should I go there? And I think that's an important thing, but you must feel good about where you're going. Number one requirement, otherwise you will not do well. And all of us are very busy already because of the number of patients that need to be done. So it really is about how you feel. You are the number one person now. Not the doctor, not your wife, your husband, it's you. So that's very important.